local. This is Fox 12 Now.
Hello, everyone. This is Fox 12 Now. I'm Greg Nibbler. As always, thank you for joining us. We are live streaming here out of the Fox 12 Oregon newsroom, something we do every weekday. Starting at 1 p.m., we go throughout the afternoon. We cover a wide range of topics. And today, we are talking about behavioral therapists, health training for them, and really everything that goes into that. It's a lot that we're going to be talking about here, and we need an expert to help explain this, and especially what's going on there at the Ballmer Institute, and that's what we've got right here with us. We've got the executive director, Dr. Katie McLaughlin, and thank you very much for joining us here today. You know, this is such an important topic and something that I think so many people can relate to, but also when you get into some of the nitty gritty as far as legislation and requirements, it gets a little bit complicated. So I appreciate you being here to help walk us through all of this. And, to start off, would you mind just letting everybody know a little bit about the Ballmer Institute there at U of O and just what exactly it all covers?
Absolutely. Well, first, thank you for having me. So the Ballmer Institute for Children's Behavioral Health represents a novel approach to improving the behavioral health and wellness of kids in Oregon and beyond. So our vision is that access to high-quality mental health support really should be a fundamental right for kids and families. Yet we know that more than half of families here in Oregon who seek mental health support for their kids experience serious difficulty finding it. So closing that gap really requires expanding the workforce to meet this growing need for support among kids. And doing that requires new approaches, which is why the Ballmer Institute is creating an entirely new bachelor's level mental health profession, the child behavioral health specialist, to help expand the number of providers who can deliver the support that we know kids desperately need right now. So our training program is going to help expand the workforce by providing students with the type of training that historically you've had to go to graduate school to get, meaning that our students are going to be ready to enter the workforce sooner. So our program also emphasizes training in early identification and prevention of mental health problems in young people, which is distinct from existing behavioral health professions. And what's amazing is that the University of Oregon is the first university in the nation to offer this kind of undergraduate degree in child behavioral health.
So that's definitely sounds like a very important step. So just to clarify a little bit of that, so this would be a bachelor's degree that they would acquire. Normally, this is a master's degree. Now, when it comes to regulations as far as being a behavioral health therapist, and correct me if that's the incorrect term for the actual position, but is that something that normally does require a graduate degree?
Yes. So in the U.S., historically, you've needed to get a master's degree or a doctorate to become a mental health provider. So the new behavioral health profession we're creating is actually distinct from what we think about as therapists. So therapists are folks like me, a psychologist, who've completed at least a master's degree that prepares them to diagnose and treat mental health problems. So therapists often work with kids once a mental health problem has really started to interfere with key aspects of their life, like their relationships or their ability to engage at school. Now, in contrast, this bachelor's level workforce that we're training is going to be focused on identifying kids who are struggling or starting to struggle at an earlier point in time before they need a therapist, and delivering what we think about as brief interventions that can really prevent mental health problems from developing in the first place or from getting worse over time. So the idea is that if we can, train and deploy this new workforce that's really focused on prevention, we can reduce the number of kids who need more intensive mental health interventions like therapy, so that the highly trained professionals who are trained to provide those services can really reach more of the kids who need them.
Okay, that's very interesting. So so this is kind of getting there before maybe this escalates to the point of needing that, and helping out a lot more students at the same time, and then funneling the ones who would need to go to the highly trained specialist. If I'm understanding that correctly. So, okay. And currently, when you look at the situation as far as in schools and in those kinds of situations, it doesn't seem like, from what I'm understanding, that's not an option right now, that it's very limited. Is that what I'm gathering?
Well, what's going on nationally as well as in Oregon is a major shortage of providers who are trained to deliver services to kids, behavioral health services. This is true in Oregon and really every state in the country. So, over the past decade or so, we've seen the need for mental health support among kids really skyrocket. And at the same time, the number of providers has actually gone down. And this problem is actually very acute right here in Oregon. So, national rankings currently place Oregon 49th of all states on youth mental health. And so what we're seeing in schools, national mental health organizations are saying that we would need literally tens of thousands more school counselors, psychologists, social workers to meet the needs, the mental health needs that we're seeing in schools, and we simply don't have enough trained professionals to address that need. And this is one way that a bachelor's level profession can really help. So by reducing the barriers to entering the field and providing really strong training in how to support kids, we can grow this workforce to ensure that all kids have the support that they need in school and beyond.
So when you talk about those barriers and the obstacles to getting some of these bachelor's degrees, the people graduating from this out into the field, what are those? What are the major obstacles?
Well, traditionally, you've had to go to graduate school to get this kind of applied training. And I can tell you more about what the training in our program looks like. But there are a lot of barriers to getting that training. So psychologists like me spend truly about a decade after they finish college, sort of preparing and learning to be ready to be licensed to work with kids. Getting into those programs is really challenging, and typically an average program might graduate literally 3 to 5 students a year. So those programs are never going to be able to create enough providers to meet the need. Now, other types of providers like social workers get a master's degree. And those degrees are expensive, right? You might have to pay tens of thousands of dollars a year to get a master's degree. And unfortunately, on the other side, we know that professions like social work, they don't get compensated in a way that makes it easy to pay those school loans. And so a lot of folks don't enter the field, even though they might really want this training, because of financial barriers, because it's simply really expensive to get that training. This is one way that a bachelor's level training program can really help by reducing those barriers so folks can get the training they want as part of their college degree.
Is there any concern out there about that it would be a bachelor's degree? I mean, nothing against the degree, but I mean, that it's a bachelor's degree instead of a more intensive and extensive master's or doctorate degree?
Yeah, I mean, absolutely. So, I first want to say that we have really good evidence from other countries that have been training folks at the bachelor's level for a while, like the UK, that providers at this level can not only deliver effective services, but that they can also really increase access to care. But at the same time, there are very reasonable concerns about bachelor's level providers doing some aspects of work that really require more intensive training. And so that's one reason that the scope of practice for this new role, so the kinds of services that they're going to be able to deliver, does not include things like diagnosing mental health problems, delivering psychotherapy, or practicing independently. And that last one is really key. So providers at the bachelor's level would need to work under the supervision of a mental health practitioner who's licensed at the master's level or above, like a psychologist, a social worker, or a licensed counselor. And a really good analogy to think about is like a physician's assistant who works under the supervision of a doctor. That supervision ensures that these new professionals will have access to the support, the consultation, and the referral sources that they're going to need when they're working with kids after graduation.
What are some of the barriers, I guess, on the legislative side? Because I know that there are some things going on with that, particularly in Nevada, and then an initiative possibly in Oregon. But can we walk through those, the legislative side of that stuff?
Sure. Well, to deliver mental health services, you need to have a credential, right, or a license. This is a regulated practice, so there have to be laws created that dictate what kinds of training would be needed to have this, to be hired into this kind of a role, what kinds of services would you be allowed to deliver, and what kinds of settings. But we've seen really exciting progress happening in other states, and Nevada is a great example. So, legislators there and mental health providers saw the enormous potential that this new bachelor's level workforce that we're creating here in Oregon has to meet this growing need for support among kids. And so this summer, the governor of Nevada signed legislation creating a license that would allow bachelor's trained behavioral health practitioners to deliver services to kids and family. And so what that means is that graduates of our program at the Ballmer Institute and other programs that are beginning to emerge in places like Nevada would be able to work in schools, in healthcare settings, and other organizations after graduating to reach more of those kids who need support. So this legislation is part of a growing movement to expand the youth mental health workforce by creating this bachelor's level profession that can work with kids in the places where help is needed most.
So that's Nevada's move. Now in the state of Oregon, currently, what's the position right now as far as Oregon on the legislative side?
So in Oregon, a task force of stakeholders from all across the state was launched as part of legislation that was passed in 2024. And they were tasked with generating recommendations on how to grow this new bachelor's level behavioral health workforce. And so that task force just this summer has formally recommended that Oregon create a credential, just like the one that got passed in Nevada, for these bachelor's level providers. So if passed, this new credential would formally recognize this new profession and allow them to deliver services to kids in a range of community settings. But, I want to emphasize why a credential is so important. It's really essential to growing the workforce in this way because it provides not only professional recognition of this new workforce, but it provides structures that would allow services to be billed to the healthcare system and oversight, really guardrails around practice to ensure that kids and families are receiving the highest quality services possible.
Something you mentioned there, this may be beyond the scope of what this conversation is about, because obviously we're talking about the need for this out there for students. But you did mention, as far as the billing, are these positions that are hireable out there? I mean, is there room for this in the workforce as far as economically, and who would be paying for that?
Well, we have been hearing from, many of our partners in the community who are working with us to train the students in our program. As part of their training, which I'm happy to tell you more about, our students spend 700 hours out in the community working with kids throughout the Portland region, and they're doing that in schools and healthcare settings and community-based organizations. And what we're hearing from the folks in those organizations is that not only is this an incredibly needed role, but they are excited to hire these folks whenever they graduate, that this is a position that they really need in their staffing. The question of who pays for it kind of depends on the setting, right? So the hope is that once a credential is in place, then we can work with the Oregon Health Authority and the relevant state agencies to ensure that these services could be billed to Medicaid or to the healthcare system. If, for example, your child went to their pediatrician and got services from somebody with this new bachelor's level license. And so that's really kind of the next step after this credential is in place. But I want to emphasize that the kind of prevention-oriented work that this new workforce is really being trained to deliver couldn't be more important, not only for meeting the needs of kids, but at this time of sort of shrinking healthcare dollars, we know that investment in prevention pays remarkable dividends in the long term. So the Oregon Health Authority did an analysis recently showing that every dollar you spend on mental health services that are prevention focused for kids, the state recovers $24 in the long term in terms of health and economic benefits from that early investment. And so it's really timely that we are building this prevention oriented workforce.
Well, I want to thank you, for joining us here to talk about this as well. But there was something at the beginning, we touched on it just a little bit, and I was hoping we could just recap this or go into it just a little bit more as far as those services that they would be providing. Because you mentioned there's the escalation to the master's, or escalation may be the wrong word, but going to the master's or doctorate level, but the services that they would be working with the kids essentially. What would those be?
Yeah, so the services really center in two key areas. So the first is early identification, right? How do you use evidence-based tools to identify kids who might be struggling, right? Before the problem has really escalated to the point that they might need to talk to a therapist. So this might involve something like, you think about when you take your child to the pediatrician for a well child visit, they ask you about all sorts of aspects of your kid's health. why isn't behavioral health part of that assessment, right? So students are trained to deliver these tools to really figure out, is this a kid who could be at risk, who could benefit from some mental health support? And second, they're trained to deliver what we think about as brief early interventions that really focus on teaching kids skills. Skills in things like how to manage stress effectively, how to deal with big feelings, how to solve interpersonal challenges that you might be having with your family or with folks at school, how to make good decisions, and how to engage in behaviors that'll help kids reach their goals. And so they learn these evidence-based approaches that don't take a really long time to teach kids, but that you might be able to teach a child in 3 to 4 visits. That really encompasses a lot of the types of services that they would be delivering.
Fantastic. Well, I mean, this is really interesting and very educational, I think, for everybody to understand, too, what this is that you're doing there. Anything else that you think is very important for the public to know?
Well, I would say that this kind of transformational work is only possible through the amazing partnerships that we have built with schools, with pediatricians, with mentoring programs, with community-based organizations all throughout the state. Oregon is truly leading the way in this growing movement to make sure that kids have access to the support they need.
Well, Doctor, thank you very much for being here with us today. I really appreciate it, and learning more about this work that you're doing there, and about these needs and the importance of this in schools and for students, for kids, for the children. It's really important. So, thank you very much for being here with us today. I really appreciate it.
Thanks for having me.
And for everybody watching, this is Fox 12 Now. We are live streaming here. We get to have these longer form conversations and discussions and go more in depth on important topics like this. And we cover a wide range of things here on Fox 12 Now. So I encourage you to download the Fox 12 Oregon app. That's a great way to follow along with what we do here live, but also after the fact. And feel free to share these segments as well. And we're going to take a quick break. We'll be back at 2 o'clock. We've got the Fox 12 Weather Podcast video edition. So wide-ranging topics here on this show, but something important as well. So that's at 2. So if you're watching me live, I'll talk to you in about a little over 10 minutes or so. I'll see you then. I'm Greg Nibbler. This is Fox 12 Now.